Hello again, everyone. So if you hear a bunch of background noise, it's because we're finally resanding the floors upstairs, and I will be moving into my brand new studio very soon. So very excited about that, and I just apologize if you can hear a bunch of background noise. Pop in the chat, let me know if you can hear me okay, and then we will get to talking about the topic for today, which is bouncing back from a failure. Okay, so in nursing school, even just one failure, one test, one skills check off, what have you, it's a pretty big setback, and you absolutely have to bounce back from that immediately. Identify the issue, course correct, and get back to it. Because if you let things slide, you're really high risk for failing another assessment, another skills check off, what have you, and then you are in massive jeopardy. Okay. All right. So, one of the biggest, I think, two things that students do when they have a failure in nursing school is they let it define who they are and let it define their entire nursing school trajectory. We're not going to do that. And the second thing that they do is they just say, I'm just going to work harder. And that's a pretty vague statement. There's really no plan surrounding that. And what does study harder mean if you're not studying in the right way, not studying the right material, not maximizing your time, all of that? Okay, so we're going to talk about some things to do when you have a failure and bouncing back from that. Okay, and hello, I see Chanel and Ashley and Stormy and Sally. Okay, so Ashley, I love that you're sharing this. Bouncing back from 2 years ago. Okay, Ashley, so great. I hope that this helps you, okay? Most students who have a failure in nursing school or who fail a class or fail out of the program, usually you fail out of the program not because you failed every class in the program, a class that's required, like pharmacology or med surg or what have you. Most of the time, students that fail in that way do so by a very, very thin margin. It's usually not a spectacular failure, right, where they actually got an F. They actually got a 76.8% and passing was 77%. So if this is you and if this has happened to you, you are not a failure. You did not fail. You got a very reasonable score on that exam or that class, but the grading scale in nursing school is so brutal that the circumstances are that you have to retake the class, right? So if you could try to get your head out of it that way, that can be helpful, okay? So usually students are like in jeopardy or have failed something because of failing an actual course, which is essentially failing the exams, because a huge percentage of your grade does come from your exams. Failing in clinical would be another one. I have seen students fail and have to retake because they failed in clinical. Like one day, one thing can happen and then that's it, which is devastating. And the other reason is failing a skills checkoff. So many schools will have skills checkoffs, obviously, that you have to perform to a certain standard. And usually they'll give you more than one attempt, but you have to pass them by 2 or 3 attempts or you fail that course. And if you fail a course, you basically have to retake it and you can't move forward in your program. So those would be the 3 main reasons that students fail out of nursing school. And each one of those things, a class or exam, clinical, and a skills checkoff, they're all high stakes events. So yeah, having a plan to tackle that as you go back in and bounce back is really, really crucial. Okay. So if you are failing a class, like let's say you have failed anything, even if it's just a quiz, even if it's just a discussion board post, especially if it is an exam, you have to course correct right now, immediately. Don't wait and see how the next one goes. Like, you absolutely have to figure this out. Okay. So one thing I like to do because it helps me. This might be something that gives you even more test anxiety, but it might not. So one thing I advise students to do is figure out exactly where you stand with your grades and the grades that you need in order to get that passing grade, right? So you can use an app. What are they called? Let me think real quick. Grade Point is one, and then there's another one that has an A plus in the icon. If you go to the App Store, I don't know about Google. I just looked on Apple, but I'm sure you can find the same types of things on Google. It's called Grades Calculator or something like that. And what it does is you input all of your assessments and how much they are weighted, and then it calculates it and you put in your grades as you earn them, and it tells you basically, in order to pass this class at the criteria that you need to meet, which for you would be whatever your grading scale is, you need to score whatever percent on the next exam. To me, that was helpful because it was motivating. I can understand how for some students it might cause more anxiety. A blanket thing to aim for is always aim for the highest grade possible. Even if you you need a 77% on the exam, don't aim for a 77%. We kind of talked about this yesterday because that's going to cut it way too close. I want you to put forth study effort, work effort for 100% on the exam, and then you're probably not going to get 100%. That would be amazing, but it's not very likely. But maybe you'll still score in that higher area because of the mindset and the effort that you're putting forth. But you can try a grade calculator thing like that. And then you absolutely have to identify where things went south, you guys. This is critical, critical, critical. You can't just say, I'm going to work harder or I'm going to put in more hours studying. That's too vague. Your study methods might be what are holding you back, and studying 10 hours in an ineffective way is not going to help you. So you have to identify where things went wrong. So some things that you can think about when you look objectively at it, like cry it out, get the emotions away, and then start putting your thinking cap on and really objectively look. So maybe it is test anxiety. Maybe when you're doing the homework, when you're doing case studies, when you're in simulation, all of it makes sense. You get it when you're doing practice questions. It's all flowing. It's beautiful. But then when you get into the exam, you freeze. You have test anxiety. And that is where you need to spend some time and addressing that, okay? Maybe you understand the concepts. You could explain heart failure to me like nobody's business, but the NCLEX style questions trip you up. So maybe you need to address how you are reading and analyzing NCLEX style questions. Maybe you're not studying the right material. Maybe you're not studying in the right way that works the best for you. If you know your brain works better by hearing the content, then why are you reading it? Read it out loud into a recorder and then listen to yourself reading it, or have your ebooks read to you. Like, find out how you learn best and study in that way. Maybe you're just really overwhelmed with how much there is to know, so you're scattered and you don't, maybe you bounce around from subject to subject to subject. You need to come up with a systematic way to study, okay? So really paying careful attention to what didn't feel right. And I guarantee if you really think about it, you can hone in on what didn't feel right as I was preparing for this assessment. And then hopefully with that knowledge, you can come up with a plan to address it for next time, okay? Now, you probably won't have all of those problems that I identified, but you could have one, maybe a couple of those. So if you have test anxiety, I have a podcast episode about test anxiety specifically because it is such a big deal. It's episode 67, I believe. I want you to go check that out if you have not ever listened to that one. If you're overwhelmed with not really knowing what to study or how to categorize it in your brain, try the latte method, you guys. It's super, super helpful. I dropped a podcast episode today that talks about the latte method. It's episode 166. It just went live today. The whole episode is kind of like how to study for med-surg in general, but it talks about some things that you can do, and the latte method is one of those. It really laser focuses you on what you need to know. If it's your learning style that you're not maximizing, I did a video recently. I don't remember which one it was, but if you go and you look on the YouTube channel, which is probably the easiest way to find it, you can find that episode where I talk about maximizing your learning style for nursing school. The other issue might be that you're trying to memorize things that need to be conceptualized, but not memorizing the things that you do need to memorize. So I talked about that as well on a recent podcast episode, and I believe I talked about it on one of these videos as well. So there's a lot of tips that I've already shared that can really, really help you guys. Time management might be another one. If you really aren't putting in the hours, the time to study, then yes, you do need to probably put in more time. Make sure that the time you're putting in works for you, okay? So maximize your study time, use your learning style, make sure you're focusing on the right information. If your lectures, and they should, but I've realized now that not every nursing school instructor is organized or intentional, but if your lectures, modules, all of that, they should have objectives listed with each one. And I will not lie. When I was an undergrad, never once paid attention to what those objectives are. I just assumed, well, the objective is to learn the information. The objectives will be very clear on what you need to focus on within that context of that subject. Use that. That's how you make your own study guide. Okay, so looking at those. So time management, if you're not utilizing your time well, not able to put in enough time to study, can you identify ways to improve your efficiency in other areas of your life so you can study more? Can you get more support with the kids, with the house, with your, parents if you care for them or what have you? Where can you find more time to study? And then make sure that you're studying super effectively, okay? Let me just pop into the comments real quick. Ashley's already printed out latte. Okay, great, Ashley. It's so helpful. One student who learns really well by staying super engaged said that she would take the latte templates and do a little bit of not a ton of pre-reading before class, but just enough to know like what the instructor was going to talk about, like scan the chapter, jot down what she kind of initially knew about the subject inside that template, and then as she was watching the lecture or attending the lecture, would fill it in the rest of the way. And this allowed her to stay super engaged with the lecture because, sometimes we zone out. I'm not going to lie. Sometimes these lectures are boring and not every instructor is very interesting, right? Okay. Jenna just read the Thrive Guidebook. Oh, good, Jenna. I'm so glad. Fantastic, you guys. Yeah, if you haven't read Thrive Guide, it's just full of tips and nursing school hacks. Okay, so Jenna, thank you for shouting that out. Sandra is having a hard time. Okay, Sandra. So yeah, so if you know that you study better with a group, then can you find a study buddy? I highly recommend not a big study group, at most 2 other people. And I did a whole thing on how to find a study group and make it work for you. So that was in one of these videos as well. So go back and check that out. It's very important that your study group people learn in the same way you do, so that as you're bouncing things off each other, it's a synergistic effect, right? You want that. You want people that are reliable, that you can count on, that are going to show up and take things as seriously as you are. So I hope that you find your people, Sandra. Absolutely. You're not studying on campus. Do your study groups on Zoom. Do it on Zoom. Absolutely. You can still meet virtually, okay? Or, if you live close enough to one another, go to each other's house. Do that. Highly recommend. Okay. So the other reason somebody might fail or be in jeopardy is because of a clinical type situation, you guys. This is huge. The really hard thing about clinical is that there's no exams, right? It's really up to the clinical instructor's judgment of if you are safe. And that's really what it boils down to. Are you safe? So when you're in jeopardy in clinical, or you feel like you might be heading that direction, clinical is already super stressful for most students. Now you're under a microscope, and that ramps up the clinical anxiety. Like if I know someone's watching me, even if I know how to do something perfect, guarantee you I'm gonna mess it up, and probably in a kind of spectacular way. So it's not abnormal to feel more anxious when you know that your clinical instructor is watching every single move that you make. The best thing you can do if you feel like you're heading down that path or you've been getting that kind of feedback from your clinical instructor is to meet with them. Don't meet with them at clinical. You've got enough going on there. Outside of clinical, set up a time to meet with them and get some concrete like objectives from them for things that you can improve on. Get concrete examples of where you are falling short, because without having a lot of healthcare background or nursing context, you might be feeling a little bit lost, like feeling like you're doing everything right. You don't know what you don't know. So get that from them and find out exactly what issues are causing you to be in jeopardy in clinical. And then you have to, again, you have to make a plan, okay? If it is with your, whatever it is, if your clinical instructor says your care plans are haphazard, they seem thrown together at the last minute, they don't include all the, maybe you have to have so many interventions or so many this or that, and you're falling short and they are telling you this, they're giving you a really huge gift to know exactly what to focus on. If it's your clinical skills, if it's your time management, if it's your assessment skills, what have you, try to get as much information as you can and then come with a plan to address those things, and then share that plan with your clinical instructor and say, okay, I took what you said to heart. Here's what I'm going to do to address it, and get their feedback on what your plan is. So that is really, really crucial, okay? Do your clinical prep work exceedingly well. It's an exam every week. Treat it as such, okay? It's really, really important. Show up on time, obviously. Be prepared, obviously. Have that good attitude. Be professional in that environment. Pretend it's a job interview, because basically it is. You want to present that professional demeanor to the nurses on the unit, because you never know, they might be hiring and you might want to work there. Never take shortcuts. Never make assumptions. If you don't know how to do something, ask, okay? Always err on the side of patient safety and on the side of caution, okay? Clinical failures, again, usually revolve around patient safety issues. So as much as you can do to make yourself super safe, and that means, you guys have heard me talk about this before probably, you've got a little angel that sits on your shoulder. And if you're ever in clinical and you hear that little angel, and what the angel usually says is, maybe I don't know this, or, sometimes it's very subtle. There just might be the slightest bit of hesitation or the slightest little voice that says, I'm not really sure about this. I'm 98% sure. Listen to that voice, okay? I guarantee you she will save your bacon many, many, many times. Okay. So let me just see if you guys have any thoughts about what I just said. Sandra, Google Hangouts, perfect. Yes, that's beautiful. Chanel, thank you for sharing that. Yeah, Sandra, sounds like maybe you're having a hard time finding a study partner that's as motivated as you are. Please keep trying. You can always reach out to someone in the Facebook group. I don't know if you're in boot camp, you might be. You can reach out there. Somebody who's in the same semester, the same class, maybe, med-surg or pharmacology or whatever, maybe they will meet with you and study with you. I've had students do that, and they studied together all through nursing school, and they became great friends. So that is also an option. A book for care plans. I really love the one by Gulanick and Myers, and Gulanick is how you spell Gulanick. And I think it's called, do I have it here? No, I don't have it here. I'm all packed up. I think it's called Nursing Care Plans. I love it. I think it's fantastic. Yes, it has nursing diagnoses in it and interventions. So that's a really good one. If Rigoberto, it can feel that way. That is probably one of the biggest frustrations of first semester students, is that everything you're learning without any context to it, and it makes it really hard. I promise that it gets easier. Okay, you guys, and then the third way that students might be in jeopardy of failing out of school or out of a class is from a skills checkoff. So pop in the chat, let me know how many attempts your school gives you. I think at my school it was 3 attempts, which is pretty generous. I never had to retake any because I didn't want to. I didn't have time. I wanted to just get it done and move on. But I was thankful that it was there, knowing that if I flubbed the first one, I could go back for a do-over. Again, if you fail one, you have to know exactly what you did wrong. So get that feedback from your instructor, okay? And then take what they tell you and you go back. And I don't want you to just practice the skill, you rehearse it. Okay, I've talked about this before. Look at whatever the grading criteria is and make yourself almost like a script of everything you're going to say, everything you're going to do, and rehearse it over and over and over again. Okay, and don't just talk through it. Like, don't just say, and then I would open the sterile field, being careful not to touch more than the outer edges. No, I want you to actually do it with your hands. You have to actually do it. If you have trouble opening sterile drapes, get a napkin and practice doing it that way. Do your head to toes on a real person, preferably on different sizes, shapes, ages of people. Okay, actually do it. You guys get 2 attempts. Some of you get 3. Okay, so yeah, doing that rehearsal and finding out exactly what it is where you went wrong. Okay, so that is, in general, my advice for bouncing back from a failure. Overall, you guys, I would say you're not your grades. Okay, so don't get all caught up in identifying as the person that failed an exam or failed a class or failed out of school. Okay, you are not your grades. And then try to just stop comparing yourself to other students. That adds a whole other layer of mental stress that you really don't need. Okay, so just focus on what you're doing to get where you need to be. And realize that everybody can have an off day, right? I have off days all the time at work where I feel like a total failure, and then other days where I feel amazing. So just know that that's normal and give yourself a little bit of grace with that. We're always our own worst critics. So be kind to yourself, please. And then just know that if you have to do remediation, if you have to do a skills checkoff again, this is really just going to serve to make you better in the long run. And who doesn't love that? So that's my spiel on bouncing back from a failure. You can totally do it. Many people do. And it's not a failure. Let's just call it a setback, okay? Tomorrow we're going to be talking about how to stand out in nursing school. I've been getting students asking questions about this, especially with online class or partial hybrid online classes. How do you stand out? Because a lot of students do want to stand out to their instructors. They want to be that star student. You never know where your education is going to take you, and it's always helpful to be remembered positively by your nursing faculty. And if you're working, looking for a job and at clinical and all of that. So I'll be talking about that tomorrow at the same time, I believe, 11 o'clock Pacific. So I'll see you then. Bye, guys.